Now we are going to start aorta. So we'll see the aorta diagram and try to understand this topic very quickly. So aorta, you can say it's a great arterial trunk. So it's an artery, right? So it's a great arterial trunk and it mainly receives the oxygenated blood from the left ventricle. So this here comes the left ventricle, right? So from the left ventricle mainly the oxygenated blood travels by means of this great arterial trunk called the aorta. So, and it mainly distributes this oxygenated blood to all parts of the body because it's oxygenated, so it will be distributed to all parts of body by means of this aorta. So aorta is mainly divided into three parts. So what are those three parts? The starting part, if you see this one, this is the ascending aorta. You can see it's mentioned ascending aorta, which is starting from the left ventricle. So this is the ascending aorta, and coming to here, this is called as arch of aorta. This part of aorta is called arch of aorta. And when you see this lower part, this is called as descending aorta. So there are three parts of aorta. One is the ascending aorta, and the next one is arch of aorta, and the third one is the descending aorta. Now we'll see some more detail about the ascending aorta. So you can see here, ascending aorta is mainly arising from the upper end of left ventricle. So this is the left ventricle starting point. So the upper end of left ventricle, it arises and it is enclosed within pericardium. You can say this is a pericardium, so it's enclosed within the pericardium and begins behind the left half of sternum. Behind the left half of sternum at the lower border of third costal cartilage. So this is the part where actually the third costal cartilage lies. So behind the lower border of third costal cartilage, the ascending aorta begins its run towards the right side. You can see it's moving towards the right side and continues with the arch of aorta at the sternal end of upper border of second right costal cartilage. So first it's at third costal cartilage. From here it's coming towards this side, means towards the right side, especially nearer to the arch of aorta, where it is in the position of second right costal cartilage. So the root of aorta, if you see the root of aorta, it has some three dilations. The three dilations are called aortic sinuses, and the aortic sinuses are in turn divided into anterior, left posterior and right posterior. So three aortic sinuses are in the root of aorta. So from this only the aorta begin, especially the ascending aorta begin. Now we are going to check out the structures which are like in relation to the ascending aorta. So you can see this is the ascending aorta in this diagram. So anterior to the ascending aorta you will find the sternum. So you can see this is the sternum. So anterior to ascending aorta there is sternum, and also there is left lung and pleura. So this is the left lung and this is a pleura. So the left lung and pleura, sternum are anterior to ascending aorta. And also you have the infundibulum of right ventricle, it will be somewhere over here, infundibulum of the right ventricle, and also you will have the root of pulmonary trunk. So you can see this is the pulmonary trunk, this is the root of pulmonary trunk. It's also anterior to the ascending aorta. And also you can find the right auricle. So the right auricle will be this right side. So these are all the structures which are anterior to the sternum. So next, what are the structures which are posterior to the ascending aorta? So the structures which are posterior are the transverse sinus, and also you'll have the left atrium, and also you'll have the right pulmonary artery. So you can see this is the right pulmonary artery, and also you'll have the right bronchus. You can see right bronchus. So these are all the structures which are posterior to the ascending aorta. And on the right side of ascending aorta, you will have the superior vena cava, and also you will have the right atrium. So right atrium also will be this side. And on the left side to the ascending aorta, you will have the pulmonary trunk above. You can see the pulmonary trunk above, and you will have a left atrium below. So left atrium will be below. So these are the structures which are related in relation with the aorta. Once again we will see in the means of this note, so that we will understand what we have understood. So anteriorly to the ascending aorta you have sternum, you also have the left lung and also pleura, infundibulum of the right ventricle, and also the root of pulmonary trunk and right auricle are mainly to the anterior to the ascending aorta. Next, coming to posterior to the ascending aorta, you have the transverse sinus of pericardium, You have the left atrium, you have the right pulmonary artery, you have the right bronchus. And on right side you have superior vena cava, right atrium. Whereas on left side you have the pulmonary trunk above and the left atrium below. So now we'll see what are the branches of the ascending aorta. So the branches of ascending aorta are mainly right coronary artery. So right coronary artery arises from anterior aortic sinus, whereas the left coronary artery arises from the left posterior aortic sinus. So already we have seen this right coronary artery, left coronary artery in the arteries supplying the heart. In that video you can find that. So the branches of ascending aorta are mainly the right coronary artery and left coronary artery. Now we will check out the arch of aorta. So we have another diagram here. So we can see this is the arch of aorta and the structures related to it. So if you see arch of aorta, it is mainly situated in the superior mediastinum. You know, actually the heart is present in the middle mediastinum of inferior mediastinum, but this arch of aorta is situated especially in the superior mediastinum, that too behind the lower half of manubrium sternum. So that's why you can see here the anteriorly you have the manubrium sternum and posteriorly you have the fourth thoracic vertebral, because the arch of aorta is mainly situated behind lower half of manubrium sternum. So the course where it starts. So the arch of aorta begins behind the upper border of second right sternocondral joint. So if you see here the arch of aorta, so it is beginning, you can imagine here the pen. As I put the pen at this side, you can imagine the second right sternocondral joint. You know, for example, this is the sternum and this is our costal cartilage. So at this joint, especially at the second sternocostal joint, in its upper border, this arch of aorta begin and it run upwards towards the left side of bifurcation of trachea, and then pass downward behind the left bronchus. So behind the left bronchus, it will pass downward and left side of the body of T4 and arches over the root of left lung. So you know this side you have the left lung, right? So it arches over the root of left lung. So this is the course of arch of aorta. So where it ends? The arch of aorta ends at the lower body of T4. So you know we have the T4 vertebra. That's why in this diagram if you see there is a fourth thoracic vertebra, because the arch of aorta ends in the T4 by becoming continuous with the descending aorta. So the beginning and ending of the arch of aorta is same, that is nothing but T4 vertebra, because it begins even at the T4 vertebra and also it ends in the T4 vertebra. So this is a speciality of arch of aorta. Now let us check out the relations of arch of aorta. So anteriorly to the arch of aorta, so you can see this is arch of aorta. Anteriorly you will find the four nerves which are arranged before backwards. So first one, if you see, that is a left phrenic nerve. So you can see this is the left phrenic nerve, and next you have lower cervical cardiac nerves or cardiac branches of left vagus. Next you have the left vagus, and also you will have some upper cervical cardiac branch of left sympathetic chain and left vagus. So these are all the structures which are four nerves which are anterior to the arch of aorta. Next we have the left superior intercostal vein. So in this diagram if you see left superior intercostal vein, this one, this blue structure, and also you have the deep to phrenic nerve and superficial to vagus nerve. So if you check out the position of this left superior intercostal vein, it's mainly deep to the phrenic nerve and superficial to the left vagus nerve. And also anteriorly you will have some left pleura, left lung, and also remains of thymus. You can see these are the remains of thymus. So all these are anterior to the arch of aorta. So you can see again once again the structures which are anterior to the arch of aorta. Four nerves from before backwards, that is left phrenic, lower cervical cardiac branch of left vagus, upper cervical cardiac branch of left sympathetic chain. Next you have the left vagus, and other one are left superior intercostal vein, deep to phrenic, which is deep to phrenic nerve and superficial to vagus nerve. Next you have the left pleura and the lung, and also you have the remains of thymus. Now we will see posteriorly to the arch of aorta what are the structures located posteriorly. So posteriorly if you see, you will have the trachea, you will have the deep cardiac plexus. So if you see here, this is the deep cardiac plexus, and also you have the tracheobronchial lymph nodes. Some of the lymph nodes are arranged here. And also you will have the esophagus. If you see, this is the esophagus, this round structure. And also you will have the left recurrent laryngeal nerve. So this is the left recurrent laryngeal nerve. And also you will find the thoracic duct. vertebral column, of course, the T4 vertebral column. So these are all the structures which are posteriorly located. So once again we'll see here, trachea is located posteriorly, deep cardiac plexus, tracheobronchial lymph nodes, esophagus, left recurrent laryngeal nerve, thoracic duct, and also vertebral column. So these all are the structures located posterior to the arch of aorta. Now we'll see what are the superior parts of arch of aorta, mainly three branches of arch of aorta. That is the bronchiocephalic, left common carotid, left subclavian arteries. So we will check out in diagram. You can see here the superior structures are brachiocephalic trunk, left common carotid, left subclavian artery. So these are the three superior branches of arch of aorta. Next we will see inferiorly. So inferiorly you will have the bifurcation of pulmonary trunk, you will have the left bronchus, you will have the ligamentum arteriosum with superficial cardiac plexus, and also you will have the left recurrent laryngeal. So what are the structures which are present inferiorly to the arch of aorta? Bifurcation of pulmonary trunk, left bronchus, ligamentum arteriosum with superficial cardiac plexus, left recurrent laryngeal. Now we will see what are the branches which are given by the arch of aorta. So mainly you have the brachiocephalic artery. This is in turn dividing into right common carotid artery and right subclavian artery, and of course on the left side you will have the left common carotid artery and left subclavian artery. So these are the different branches, right side branches and left side branches. Right side branches are mainly by brachiocephalic artery dividing into right common carotid artery, right subclavian artery. Left side you have left common carotid artery, and you also have the left subclavian artery. So now we will see some details of our descending thoracic aorta. So descending thoracic aorta diagram is over here. So you can see this is a descending thoracic aorta and the structures which are related to it. So now we will discuss this in detail. So descending thoracic aorta is a continuation of arch of aorta. So coming again back to this diagram. So the arch of aorta only just continues as the descending thoracic aorta, and it lies in the posterior mediastinum. So remember that the arch of aorta is in the superior mediastinum, but the descending thoracic aorta is in the posterior mediastinum. Then where is the ascending aorta? So ascending aorta is located in the middle mediastinum of inferior mediastinum itself. But the arch of aorta is only located in the superior mediastinum. Descending aorta is located in the posterior mediastinum. So where it begins? The descending aorta, you can say it is beginning from the left side of lower border of body of T4 vertebra. It descends with the right inclination and terminates at lower border of T12. So you can remember the descending aorta. You can see here. This is also called as descending thoracic aorta. It is beginning on left side of lower border of T4. So beginning at T4 vertebra and ending at T12 vertebra. Descend with right inclination and terminates at lower border of T12 vertebra. So what are the structures which are related to it? Let us find out. So you can see here, this is the diagram descending aorta. So anteriorly we will have the root of the lung. Here we will have the root of the lung anteriorly, and also you will have the pericardium, heart, and of course we'll also have esophagus in lower part. So if you see this esophagus in the lower part, and also diaphragm, of course it's situated over here. So these are the anterior structures. And posteriorly you will have the vertebral column and also hemiazygous vein. You'll get a hemiazygous vein over here posteriorly. And on right side, especially on right side, you will have the esophagus in the upper part, and you will have the azygous vein, because on right side, right, azygous vein, on left side you will have the hemiazygous vein. So on right side you will have azygous vein. You will also have the thoracic duct, right lung and pleura. Right lung and pleura are also associated with that. Whereas on left side you will have the left lung and the pleura. So left side only two structures, left lung and pleura. So once again we will revise them to understand them clearly. So anterior to the descending thoracic aorta you will have the root of the left lung, the pericardium, the heart, esophagus, especially in its lower part, and also diaphragm. Whereas posteriorly, if you see, we have the vertebral column, hemiazygous vein. Always remember, hemiazygous vein is on the left side. And right side, of course, you will have the azygous vein, esophagus in the upper part, thoracic duct, right lung and its pleura. Whereas on left side, you will have the left lung and the pleura. Now we'll see what are the branches, what are the different branches which are arising from the descending thoracic aorta. So if in the name what's only you can understand, thoracic aorta means all the structures which are related to the thorax are its branches. So first you have the 9 posterior intercostal arteries which are on each side for 3 to 11 intercostal spaces. Already in my videos there is about posterior intercostal arteries, you can check there. And also subcostal artery, if you all remember, the subcostal artery is the last branch, that is the 12th branch of arteries, right? So the 12th artery is a subcostal artery. It is also present on both sides. It is also a branch of descending thoracic aorta. And you have 2 left bronchial arteries. Of course, as I said, all the structures are related to the thorax because the name itself is descending thoracic aorta. So 2 left bronchial arteries, mainly right bronchial artery, arise from the 3rd right posterior intercostal artery. So 3rd posterior intercostal artery will form the right bronchial artery. Already this one also discussed in my previous videos, if you remember. And we also have the esophageal branch, which mainly supply the middle 1/3 of esophagus. So what are the structures which are mainly supplied by the branches of descending aorta? You have posterior intercostal artery, you have subcostal artery, you have bronchial arteries, you have esophageal arteries, and also you have the pericardial branch to supply posterior surface of pericardium. So mainly posterior surface of pericardium. Mediastinal branch to the lymph nodes, areolar tissue of posterior mediastinum. So mainly pericardial branch also to posterior of pericardium, mediastinal branch also to posterior of mediastinum. Next you have subphrenic arteries. These are also to posterior part of superior phrenic arteries. These are also supplying to the posterior part of superior surface of diaphragm. Phrenic in the name itself, you can imagine that is going to supply the diaphragm. So it's a branch of these arteries are anastomosing with those of musculophrenic and also pericardiophenic arteries. So that is the main thing to remember here. That branch of these arteries anastomose with those of musculophrenic and also pericardiophenic arteries. So that is the main thing to remember. So once again we'll revise what are the arteries, what are the branches of descending thoracic aorta. Posterior intercostal artery, subcostal artery, bronchial arteries, esophageal branch, pericardial branch, mediastinal branch, superior phrenic arteries. So these in turn are going to these branches, especially superior phrenic arteries, are going to anastomose with the musculophrenic and also pericardiophenic arteries. So by this we have completed a quick understanding of our aorta, and also we have discussed the 3 types of aorta mainly here: the ascending aorta, the arch of aorta, the descending or thoracic aorta. So in the next video we will discuss in detail about pulmonary trunk. It's a very short video, very simple one, pulmonary trunk. So we will also add to this pulmonary trunk topic the clinical anatomy. So the clinical anatomy and pulmonary trunk are in the next video.